How to treat coronavirus. Method 1. Recognizing the symptoms. Number 1. Watch for a runny nose, sore throat, and other cold-like symptoms. Check with a doctor because it may just be a cold. Most types of coronavirus cause mild to moderate cold-like symptoms which generally don't last much longer than a week. Number 2. Make note of headaches and body aches. Some coronaviruses, such as the virus that causes SARS severe acute respiratory syndrome, can cause flu-like aches and pains. Be on the lookout for headaches and pains in your joints and muscles, especially in combination with a fever or other flu or cold-like symptoms. Number 3. Check for a fever. Severe forms of the coronavirus, such as SARS, MERS, Middle East Respiratory Syndrome, and the new China strain 2019 nCoV, often start with a high fever. Check for a fever of 100.4 degrees Fahrenheit, 38.0 degrees Celsius, or higher. You might also experience chills or episodes of sweating along with a fever. Number 4. Look out for a cough and shortness of breath. Some forms of coronavirus, such as SARS, MERS, and 2019 nCoV, are characterized by severe respiratory symptoms. These symptoms typically include coughing and shortness of breath, along with a fever. Number 5. Pay attention to diarrhea or vomiting. Sometimes coronaviruses can cause gastrointestinal symptoms as well as respiratory problems. You may have a coronavirus if you have symptoms such as nausea, vomiting, or diarrhea, especially if you also have a fever and respiratory symptoms. Method 2. Getting medical care. Number 1. Call your doctor right away if you think you have a coronavirus infection. A coronavirus infection can potentially become deadly, especially with a serious strain such as MERS, SARS, or 2019 nCoV. If you have recently been exposed to a person or animal with a coronavirus infection, or if you live or have traveled in an area where these viruses are active, contact your doctor immediately if you start to develop symptoms. Number 2. Allow your doctor to test you for a coronavirus infection. If you have severe symptoms or if they suspect you may have contracted MERS, SARS, or 2019 nCoV, your doctor may recommend a laboratory test to confirm your diagnosis. These tests typically involve taking a sample of your blood, sputum, saliva and phlegm that you cough up, or material from a swab inserted into your nose or throat. If your doctor suspects you have 2019 nCoV, your labs will be sent to the Centers for Disease Control (CDC), as they are the only organization that can do diagnostic testing for the novel strain at this time. Number 3. Follow your doctor's home care instructions carefully. There's no specific treatment for coronavirus infections yet. It is a viral infection that cannot be cured with antibiotics. If your doctor diagnoses you with a coronavirus, they will likely send you home unless you have severe symptoms that require hospitalization. Ask them for instructions on how to care for yourself and prevent the disease from spreading to others. Number 4. Stay home and rest as much as possible. Getting plenty of rest is vital for helping your body fight the infection and recover. Additionally, staying home will help prevent you from spreading the infection to others. While you're infected, stay home from work or school and avoid strenuous activities around the house. Get as much sleep as you can. Number 5. Take over-the-counter medications to manage pain and fevers. If you have symptoms such as body aches, headaches, or a fever, you can get relief with medications such as acetaminophen, Tylenol, ibuprofen, Motrin, Advil, or naproxen, Aleve. If you are over 18, you can also use aspirin as a pain reliever and fever reducer. Number 6. Use a humidifier to ease a cough or sore throat. A humidifier can help soothe your throat, lungs, and nasal passages. Set one up by your bed at night and wherever you spend most of your time resting during the day. Number 7. Drink plenty of fluids. It's easy to get dehydrated when you're sick. While you're recovering from a coronavirus, keep sipping on water, juice, or other clear fluids to fight dehydration and loosen up congestion. Warm liquids, such as broth, tea, or warm water with lemon, can be especially soothing if you have a cough or sore throat. Number 8. Get emergency care if you develop severe symptoms. Some types of coronavirus, such as SARS, MERS, and 2019 nCoV, can develop into life-threatening infections. Go to the emergency room or call emergency services if you develop severe symptoms, such as difficulty breathing or chest pain when you breathe. Method 3. Preventing coronavirus infections. Number 1. Limit contact with infected people as much as possible. Many strains of coronavirus can be spread from person to person, and it appears that the virus can be transmitted even by someone who is not symptomatic. If you know or suspect that someone is sick with a coronavirus or has been around others with coronavirus, avoid close contact with them as much as you can. Always wash your hands thoroughly if you have to touch an infected person, and consider wearing a mask around them. Number 2. Stay away from farm animals and wild animals. Many coronaviruses are spread from animals to humans. The most common animal carriers of coronaviruses are civet cats in China, dromedary camels in the Middle East, and bats. If you come into contact with animals of any type, especially in areas where coronaviruses are a problem, always wash your hands carefully. Number 3. Cook meat and other animal products thoroughly. You can get coronavirus infections and other diseases from consuming contaminated or poorly prepared meat or milk. Avoid eating raw or unpasteurized animal foods, and always wash your hands and any surfaces or utensils that have come into contact with raw or untreated meat or milk. Number 4. Wash your hands regularly with warm water and soap. Hand washing is one of the best ways to prevent the spread of coronavirus and other diseases. Use warm water and soap frequently throughout the day to clean your hands, especially after touching surfaces in high-traffic areas such as doorknobs in public bathrooms or handrails on trains and buses, or potentially infected people or animals. Number 5. Avoid touching your eyes, nose, and mouth. Respiratory viruses like those in the coronavirus family get into your body through the mucous membranes in your eyes, nose, and mouth. You can protect yourself by keeping your hands away from your face, especially if you haven't washed them recently. Number 6. Clean and disinfect all objects and surfaces a sick person has touched. If you or someone in your home is sick with a coronavirus, prevent the disease from spreading by cleaning anything they come into contact with. Use 1 cup 240 milliliters of bleach mixed with 1 gallon 3.8 L of warm water or a disinfectant wipe or spray to keep things clean. Make sure the surface stays wet for about 10 minutes for the disinfectant to work effectively. Number 7. Cover your mouth whenever you cough and sneeze if you're infected. People with coronavirus infections spread it by coughing and sneezing. If you have the virus, you can keep other people safe by using a tissue, handkerchief, or face mask to cover your nose and mouth when you cough or sneeze. Number 8. Pay attention to travel advisories if you plan to visit other countries. If you're planning to travel abroad, visit your country's travel website to find out if any dangerous strains of the coronavirus are active in the area you plan to visit. You can also check the website of the Centers for Disease Control and Prevention (CDC) or the World Health Organization (WHO) for information. These websites can offer advice about how to protect yourself while you travel,